Live from the Hive, I'm Dr. B, and this is The Buzz on birthmarks. Birthmarks can be pretty concerning, so let's talk about the major ones. Hemangioma is the first one to talk about. This is one that really worries a lot of parents. They wonder, how big is it going to get? Is this going to get? If I bump it, is it going to bleed? Is it going to cause some scarring? Well, the therapy on these depends on where it is and how big it is. Generally, we don't do much for these if they're in a location that's not going to get a lot of trauma or a lot of friction. And generally, these go away after a few years. They may go away pretty quickly, but they can take up to 9 or 10 years to go away sometimes. They will get bigger. They will look puffier for your typical superficial hemangioma like this one seen in the hair. They will get bigger. They shouldn't grow out of relation to the child. They shouldn't get giant when the child only grows a little bit, but they will get bigger if the child gets bigger, which they will. Generally, what these do is they kind of outgrow their own blood supply. The blood clots. They start looking kind of dusky. They start looking mottled, and over time they go away. Sometimes you're left with just a little silvery mark, a little scar of where it was. This is usually very hard to see. If it's in a bad area, and I mean a bad area like something that's going to obstruct the vision or cause feeding problems or something like that, or on the fingers and it might get in the way or get damaged, then there are medications we can use. Beta blockers are typically used for this, either topically or orally. But that's something that you would talk to a dermatologist about. But if you do see these on your newborn, don't worry too much about them. We will talk about them, or your doctor will talk about them in the office. And what you're seeing here is this has a lot of names. It's a macular stain is what we call it officially, so that we sound smart. It's also called a salmon patch because it's kind of salmon colored. This one's actually pretty dark, but usually they're just a kind of a pinkish salmon color. On the back of the neck, this one we call a stork bite because that's where the stork bit you when it was carrying your child to the parents' house. Typically, these ones go away after a few months, but as you can see here, there's a little faint pink area. This is obviously an older child, and this person has a stork bite that's still there. The ones on the back of the neck can last for quite a long time. If you see these on the face, then that's what we call an angel's kiss, but it's exactly the same thing. And you can see on each eyelid you have little angel kisses, and on the forehead, usually on the forehead it's shaped kind of like a V. You can kind of get the impression of a V there, and that's just another type of another angel kiss on the forehead. And when the kid cries, very often this will look really dark and angry, and it's kind of spooky looking. My twins had these, and when they screamed together, it was kind of freaky. But these are on the face. They typically go away a little bit faster, maybe only a couple months, and almost always these ones go away, as opposed to the ones on the back of the neck that may leave a little pink mark. Next, we're talking about dermal melanocytosis. That's the official name. Formerly, these went by a little less politically correct names of slate gray nevus and Mongolian spots. We don't use those terms because they're not politically correct. But if you do hear them, that's what we're talking about, is the dermal melanocytosis. This looks, pretty severe, but this is actually completely benign. This is just extra pigment in that area of skin. This is typically in people with darker skin. You might see it in African Americans. You might see people of Asian descent having this. The big thing about this is commonly mistaken. The common story is that this is mistaken for a bruise at daycare. This one should be pretty obvious that these are not bruises, but sometimes if you just see one or two on the back, daycares get excited about that. And I think it's great that they're being observant. But this kind of dermal issue is not from a bruise. This may take a long time to go away. Sometimes you will see these on adults with darker skin, but they usually do fade over time. Now let's talk about congenital nevus. This child has several, so they're called congenital nevi, but a nevus is basically a big mole. The one on the leg, on this child's right leg, and there's one on the left knee it looks like, but the one on the right leg is typically what we see. That is pretty large by itself. That's typically what we see, though. It's just a dark brown or brownish black area. And generally, these are not harmful. The bigger these are, though, the worse the outcome can be. And as you can see, this child unfortunately has a very large one all across the right arm. The bigger these are, the higher chance there is of it turning into something bad down the road like melanoma. Typically, that'll take decades to happen, but it can happen earlier. So in these cases, you would have to have this child see a dermatologist and talk about what to do. But typically what we'll see is what you see on the right leg, a much smaller one. And those usually just keep an eye on, maybe see the dermatologist down the road, but it shouldn't turn into something bad. Now this is a little bit hard to see. This is called a cafe au lait spot. And you can see it's kind of in someone with fair skin, it's going to be kind of a, well, cafe au lait color. It's going to be a little bit beige, and it's a regular border. It looks kind of like, I don't know, Nova Scotia or Ireland or something. But the border is irregular, but it's still well demarcated. You can kind of tell where it ends and where the quote normal skin begins. Usually these don't mean anything if there's only a one or two of them. If there are many of them, 6, 7, 8, then we start to think about genetic diseases like neurofibromatosis or McCune-Albright syndrome. But if you see 1 or 2, it's not anything to worry about. Your doctor will go over what these mean, if anything. And generally, like I said, they don't mean anything. Now, this is a picture of a skin tag in front of the ear. You can have skin tag, well, a couple skin tags in front of the ear. You can have skin tags just about anywhere. We often see them on the neck or on the chest or on the shoulders. Generally, again, these don't mean anything, but if you have them in front of the ear like this, then this is called an accessory tragus. It's not just a regular skin tag, but it's actually an ear deformity. And for these kids, there's a slightly higher chance of having a hearing problem. Most of the time, we just leave the skin tags alone, but if you want to have something done about it, then these can be removed surgically. And finally, this isn't exactly a skin problem, but it's on the skin anyway. This is lanugo, which is not a birthmark, but it's just very fine, wispy, downy baby hair that you'll see very often on skinny babies or premature babies, very small babies. And this is usually on the back or the shoulders. Parents always ask, when does this fall out? And I always tell them it'll be gone by junior or senior prom, which is not untrue, but usually this only lasts a couple weeks. But I like to have fun sometimes. Birthmarks don't look the same in every baby. Sometimes they don't show up right away. It may take a week or two for some birthmarks to show up. So if you have questions about birthmarks, make sure you talk to your doctor. Thanks for watching today. We're going to continue our skin series with skin rashes next time. I'm Dr. B. We'll see you then.